we are definitely at a different point in the pandemic. Over the last 2 years, the administration has made significant progress in ability to manage COVID-19 in a way that protects life and health and no longer meaningfully disrupts our lives. And that's because of this president's leadership. Again, we're not out of the pandemic. We're certainly in a different place. And that's because what this president has been able to do.
It's great. On the COVID-19 public health emergency ending on Thursday, obviously we know COVID is not over, and in fact CDC data shows that there's a disproportionate share of hospitalizations and infections and deaths for Black, Hispanic, and Indigenous populations. These are also populations that are overrepresented in lack of access to health care, unemployment, poverty levels. Is the administration concerned that these communities could be left behind as we move away from the public health emergency, especially when you think about long COVID?
So there's a couple of questions there with long COVID, and I'll take that first. Look, we've seen the progress that has been made last year that HHS has led on, and that's deliver high quality care for individuals experiencing long COVID, provide information and resources to help people struggling with long COVID, including our nation's veterans, employees, in the workplace. And we've invested in care for people in underserved communities who have been disproportionately impacted by long COVID. There's going to be an office that's going to be set up, as you know, that because of the omnibus fiscal year of 2023. Certainly that'd be a space where we'll continue to deal with the pandemic, even though we're in a different stage of a pandemic. As you said, COVID is still here, so we'll certainly deal with that in an appropriate way. And so, look, there's the Project Next Generation as well. That's a way to stay ahead of the rapidly evolving virus that causes COVID. We need to continue to support the development of a new generation of tools, and that's what you're going to see from Project Next Gen. So we are taking all of this very seriously, and we certainly have more to share in the next day or two.
More broadly, could you give a sense of how the administration is feeling coming out of the public health emergency, given where we were 2-3 years ago? Does the administration see this as a success in terms of combating COVID, or a sense of sigh of relief at all?
So look, we are definitely at a different point in the pandemic. Over the last 2 years, the administration has made significant progress in ability to manage COVID-19 in a way that protects life and health and no longer meaningfully disrupts our lives. And that's because of this president's leadership. Again, we're not out of the pandemic. We're certainly in a different place. And that's because what this president has been able to do. When you think about how COVID deaths have declined by 95%, new COVID-19 hospitalizations are down nearly 88%, and COVID-19 cases and deaths globally are at its lowest levels since the start of the pandemic. You heard from the World Health Organization saying COVID pandemic no longer qualifies as a global health emergency. So look, let the numbers speak for itself. The president, over 270 million people have at least one shot in arms because of the comprehensive plan that this president and his administration has put forward. And so, look, again, let the numbers speak for itself. The president has taken this very seriously since day one, and now it's good. It's actually good that we're in a different stage of this pandemic.